Okay, I think I'm awake and alive. Are we awake and alive? I believe so. So many deputies. Okay. Welcome in. Hi, everyone. We're gonna do a quick med shift today because I'm clearly full of energy. Okay, I'll get my phone away from my microphone so there's no clicking. Here she is. Here's a girl. See how many people are dying. Let me also clock on. we can do it. Looking good. Look at the plaid. We're rocking the plaid in honor of Tess, whom we love but never see. This looks bad. This is a lot of horses. It's probably fine. No. Didn't turn on TeamSpeak. Didn't turn on TeamSpeak. No. No. Everyone be cool. This is the trainee's first time meeting us. I know you do.
Hello, how are we?
Very well. Pleasure to meet you. I'm Claire, Senior Dr. Claire Corbin.
It's a pleasure to meet you. I'm Silas Bigsby.
Mr. Bigsby, an absolute pleasure. How has your shift today been so far?
It's been a little eventful. I woke up and shortly thereafter we had our first patient come in.
No, and how did that go?
It went quite well. We treated her rather expediently, and now she's back over at the sheriff's office, telling all her friends what happened.
No, very good. What did you learn from the procedure?
Well, first of all, put my suture into practice, so that was nice. And then additionally, Cam here, fixed the nose. She had a nasty broken nose, so Cam here reset it. So I was witness to that, and applied some honey salve to the sutures on her face so that it wouldn't dry out and crack. And bandaged.
No, well, very good. Sounds like a good, well, representation of most of the work you'll be doing.
Pretty much.
Unless you have a specialty in mind. Quite curious about that.
I don't really have a specialty in mind. I'm still trying to get my bearings on what's needed around here and whatnot. So I think the general practitioner is really what I'm just focusing on right now.
Quite reasonable.
Mm-hmm. What would your specialty be?
I am the department's herbalist. That and general surgery.
Oh, very nice.
My...
Oh, hello.
Excuse me.
Hello.
Pardon the interruption. Have any of you seen a gray, black spotted horse ride through here?
I have not.
Fellow by the
Negative.
name of Ly Haynes riding on top of it.
No
Can't say
luck.
I have.
But if we do, we'll send in a tip.
Thank you. Yeah, he just kidnapped the deputy, so we're looking for him.
Understood.
Ah.
Alright, appreciate it. Thank you.
I hope it wasn't the one that we just treated.
Oh, I imagine she's over at the office with the rest of the deputies, so hopefully
I
not.
would hope so.
Can't believe Amberlynn Reed died. Oh my god. Okay, we gotta read this training spot.
Claire, I did need to talk to you when you had a moment.
Absolutely. Well, would you like to do it now and step aside, or wait until we're off duty?
No, I don't know how much longer I'm gonna stay on duty.
I can step aside. You all can stay here. I'll just be right in the office over here.
Understood it. Oh, the buckets.
No, not the buckets.
And
I
apologies.
have a problem doing this.
No, it's okay. It's this is small in comparison to some of the travesties I have caused. And apologies for asking of this. Hopefully not long until you have your sash and can be included in.
Oh, of course, of course. I understand completely. You all take your time, all right?
All right, let's just pop into the back office, Cal.
Mm. Excuse me, bucket.
What's going on?
The patient that I was involved in losing the other day, I guess, I don't know, I'm James Crowley. It's really the first patient that I've lost where it wasn't pretty immediately evident that it was going to go that way. And I guess, I don't know, I feel like I could have done something more.
Oh, I'm so sorry, Cam. Did you treat them alone? I haven't read the paperwork.
Son was there. Son was there, and so was Trainee. It was his first day too, so.
Oh, okay. I'll make sure to check in with him as well. Is it just sort of an uneasy feeling? Have you had trouble sleeping?
Yeah.
Anything else going on?
A little trouble sleeping, yeah. He had a through and through to his chest, and his lung was damaged, and I couldn't get the sutures to completely hold where we could reinflate his lung. He stopped breathing, and it wouldn't hold, so.
Did you do everything in your power in that moment to help him?
Yeah.
then there is nothing else that I or the department could ask of you.
Okay.
I don't think now is the time to go over the case in detail, but if you would feel that it's helpful, we could review how it went. Just yourself or with Sun and the trainee. If
Okay.
you wanted to talk through it, but you did everything in your power in that moment with the tools you had to try and save that man's life. I know, I truly know that it does not make a difference what anyone says to you right now. You're gonna feel it.
Yeah.
That's okay.
Yeah. It was the first time I've actually even written up the death certificate.
Have you experienced with death elsewhere in your life? Personally?
No. Well, my mom when I was 5, but she passed away. I was young, obviously, so.
Didn't quite feel the full weight you do when you're not only an adult, but also, responsible for trying to stop it.
Yeah.
Well,
I mean, I've been there when other people have died, but I mean, with Hazel and one other, it was obvious when we started that it was not going to end in a good way.
Mm. I'm curious if you had to name sort of the predominant emotion you're feeling, and it's okay if you can't. There might be a lot, and they might feel confused between each other. What would you say you're feeling?
Mostly confusion. I feel a lot of sadness over that. Then also the other stuff that's not work related that happened after that causes a lot of happiness. So it's a lot of confusing. It's a confusing time now.
Yeah, well, life is like that. Unfortunately, it's
Yeah. You know, I would have telegrammed you the happy stuff, but I was slightly terrified you might die at telegrams or
Well, yeah, probably a good chance.
scare somebody.
If it's what I'm thinking, probably it is.
It is, yeah.
That's really good, Cam. And I think a really good reminder, that even if the passing of life is happening, there is life that continues all around.
Yeah.
And you just really have to hold on to that. Okay.
Okay.
I'm really glad that you came. And capable of talking about it. Even if you couldn't, that would be perfectly acceptable. It's an awful thing. But, just hold the things that you know are true as hard as you can, until your mind and your body catches up to it.
Okay.
If you'd like, we can get you some valerian root tea to help with the sleep. A tired mind certainly doesn't improve things.
Yeah. The tea would be nice, yeah.
Good. Okay, well, we'll take it from my personal stock then.
Okay.
Only the best. Not what I give patients. Blah.
Did you want to hear up to date?
Yeah, but only if you want to tell me.
Of course I want to tell you.
I'm screaming really quietly so the trainee doesn't hear. Okay. Oh. Alright, I'm steadied. Tell me.
You're steady? Okay. All right. We went on a boat ride on the lake, the Ikea lake. And then
So cute.
we went to the Adillo newspaper office. I've never seen it. And then he showed me his favorite spot in the West, and we just sat there on our horses for like 2 hours talking.
Oh, yeah, that's lovely.
Yeah, it was really nice.
I am very glad you've met someone who makes you so happy.
He did tell me that his ex-husband is back in the crossing.
Okay, that's nothing we can't deal with.
Yeah, well, he said he wanted me to know because he didn't want me to run into, although I don't think I ever met him, so I wouldn't even know if I ran into him. But
yes,
he didn't
what
want
was
me
his
to run
name?
into him.
Casper
and felt,
and
James, I think? Or maybe that was the
George
last name.
James. Okay, that's okay. I'll be on the lookout.
Yeah, he said they're not getting back together at all. There's no chance of it happening. So, but
Okay.
he just wanted me to know.
Okay,
so that
good.
He didn't. I didn't feel like maybe he was hiding it from me if I ran into him.
He's thinking about your future, Kim. He's thinking about your future together. My heart's gonna explode.
No. This is why I didn't telegram it to you.
I'm just so happy for you.
He said next time he's gonna take me fishing.
Oh, he's already planned the next date, Kim. This is incredible. What good news for me?
Fishing.
What good news for me specifically?
Yeah. Specifically.
Bring it in. No. I'm so proud of you, Cam. My actual heart's gonna explode. Okay, now let's get out there and train that trainee.
Yeah.
But if you need to talk at any time or walk away, please.
Mm-hmm.
Also, where is Clara?
She was in Rhodes.
Going
She
towards
might be in
Valentine.
Valentine.
Okay.
I do have a telegram because I did telegram her because I need to up her about, well, you know, this all of this is, you know, because of her.
Oh, is it?
Well, yeah, she's the one that suggested him.
Okay, fine. She said she made a good choice.
because I asked her, I said I don't want to ask Myrtle again because she might set me up with a criminal, and you know, my coworkers would not such a thing. And
you know, there's only room for one criminal in the relationship. I understand. That's Cupcake.
I'm sorry about the bucket.
Oh no, truly. There have been everyone gets at least a few a week, and without any trouble. So please don't be concerned.
Right. Okay. You'll you have to forgive me. What kind of accent is that?
Oh, I speak French as a first language, but I'm originally from Quebec.
Oh my, that's rather interesting.
Yes, I mean there are several French speakers around the crossing, but I believe I'm alone in my Quebecois.
I think so. I don't believe I've ever met anybody from how do you pronounce it? Quebec?
Yeah. However you'd like, Quebec is the most common way of saying.
All right, Quebec. I don't think I've ever met anybody from Quebec.
Oh, well, I love talking about home. So if you're ever curious, please feel free to ask away.
Yeah, of course. I know there's a couple of different places in Quebec. Which city or town are you from?
Quebec City itself.
Oh, well, there you go.
Gobbled
Easy enough to
streets.
remember.
Busy. It's a port city, so lots of ships in and out, hustle and bustle.
Yeah.
My favorite, there's a large hotel high up on a hill. The Chateau Frontenac. It is, oh, beautiful. You can imagine it towering over the theater, even, with its green roof. It's beautiful. I used to imagine being in it as a child. Maybe.
Wow, my, that does sound quite beautiful, actually.
Nothing compared to winter, where it is quite cold and dark, but, well, the thing I love to tell people about is the winter carnival. They build a huge castle of ice and have it lit up with torches inside. There's warm tarts and warm drinks, and everything is just lit up beautifully. And you get to be.
Goodness, you're gonna make me go there, and I don't even speak any French.
Well, I always offer to take folks. It's a great passion to share a little bit of home. But that's enough from big old Claire Corbin. I am curious if there's anything that you have run into in your shift so far that you felt you need to know but didn't know.
Well, I didn't exactly know how to reset the nose. I watched Cam do it, and they seem to do it with rather ease. So I was wondering, how do you exactly know where to set it? Just follow the bridge, like the top of the nose, and try and align it the best you can, or what?
It's a little tricky. Sorry, I guess before I explain, have you been to medical school at all?
I have. I went to the University of Louisville.
Okay, perfect. So then you know that the actual nose itself is a hole within the skull, and the cartilage protrudes past it. Now the cartilage itself is actually quite forgiving. That is tough to break. Mostly it becomes misaligned. Hello.
Howdy.
So our job is to sort of realign it back into place. I'm not sure if you heard a bit of a crackle or a snap as Cam was realigning.
I don't. There was too much of a crackle or a snap. Did it rather easily. I didn't hear anything.
Sometimes that is just the degree to which it was misaligned, or perhaps just the quirk of the body. But for the most part, you can do it entirely externally. But I would use a longer forceps, perhaps something to brace the inside of the nose, and sort of realign that way. The same tool you might use for blunt dissection. down through a muscle to sort of push things out of the way. Can use the same thing or a similar instrument for the resetting a nose.
Right, okay.
The important thing is to make sure with, however it was injured, if it was a blunt force to the face, say, that no part of the nose itself was broken off, past the cartilage. Then it becomes quite a more significant surgery to either remove the fragment or to try and repair it if we can.
Right, because at that point it's almost turning into a reconstruction.
Absolutely. And at that point, we would weigh the risks and benefits of the surgery. Can they live with a crooked nose without us, perhaps accidentally lodging a piece of bone deeper with the elevator that we use to reset it?
Right. Okay. But I think other than that, it was a pretty routine treatment, wouldn't you say, Cam?
Yeah. Yep. Gunshot, graze, laceration to the forehead.
Is there anything that either one of you believe that I should know that you see just about every day that you think is vital?
Well, I am just looking to see if there's a... Oh, we haven't... Oh, there's so much to go through for you. Good. Okay, I mean, there's lots.
Yeah.
Mm-hmm.
we only had the one case on his first that's the only thing.
Okay,
we did do some practice with a pig.
Do you have
That's it.
20 minutes?
I do, yes.
Okay, perfect. Everyone follow me.
Okay.
No, this is the newspaper office. Everyone follow me this way.
Newspaper.
Yeah, it's gonna be a big story. Okay, here we go. Oh my god, a cougar!
A cougar? Well, first of all, we need to make sure the cougar isn't around. Okay, cougar's not here. All right, now let's check over our patient. My goodness. Her heart rate is elevated, but it's rather weak. And she's breathing very, very slowly. Okay, so this could be from wounds or it could be from the shock, wouldn't you say, Kim?
Yeah, that is only possible.
Okay, alrighty. So, since I'm... Give me one moment here. Just gonna give her a check and make sure she doesn't have any scratch marks, bite marks, or something like that. You're gonna ruin the shirt.
I've done this so many times. I've ruined so many shirts. It's always worth it.
Oh my goodness. Okay, all right. So let's see here. Looks like she might have some wounds on her shoulder and on her leg as well. let's see here. It looks like the shoulder is bleeding more profusely than the shin.
Oh, my leg.
Oh, your leg. Oh my goodness. The leg is also broken. Okay. So what we're gonna do is we're gonna go to the shoulder first because it is a more serious wound, I believe. Alright, let's see here. I should be able to see this wound more clearly. Oh my, this is dark red blood. That's not good, actually. That's very not good.
Why is it not
Okay,
good?
we need, because it usually indicates arterial bleed.
Oh, interesting. Does it? Let's talk it through.
I'm pretty sure it does.
We know it's
I'm
arterial
almost certain it does.
because it's oxygenated, correct?
That's right.
And oxygenated blood is bright red.
Oh, I have it backwards. Oh shit.
Muscular is
Excuse me.
dark red. Arterial, bright red.
Right.
This is why we do the
I'm
Cougar
sorry.
attack. No, this is perfect. Good, good, good.
Okay, all right. So she has some severe muscle damage here. Need to adhere to that.
All right, so you start digging down. You do eventually see the bullet. It's kind of lodged underneath the sort of collarbone area.
The bullet.
This
I
is
thought this.
it's
Why does a cougar
it's the
have a
classic
bullet?
gun-toting cougar.
Oh my goodness. This is. I did not expect this. All right, all right.
No one asked about what weapons the cougar used.
No one expects a cougar to be carrying a damn gun either.
Yeah. No, this is the type of curiosities you get working at the Saints Crossing Department of Health. All right, what are you looking for when you're flushing?
Okay, while I'm flushing, I'm looking to make sure that there's no debris that's coming out every time that I flush. I'm gonna keep flushing until the debris stops coming out of there, and it's almost clear, like the saline water is.
Okay, good. Eventually, it starts coming clean. There is still a little trickle, but it's nothing you're worried about.
Right. Okay. Okay. And then at this point, I'm going to observe and see if I can extract this round without causing further damage. You said that it's underneath the collarbone.
Correct.
Okay. All right. If it's underneath the collarbone, I need to make sure that there's a way that I can extract it without damaging the collarbone. Do I see that the collarbone is damaged?
There's a small chip.
A small chip. Okay. All right. Then correct me if I'm wrong, but I should be able to. And this sounds very painful. I could be completely wrong, but I would want to lift up that collarbone slightly just so that I can help extract that round a little easier.
Okay, well, it's pretty stuck in place. You're not going to be able to lift it, but you can certainly go
Right.
underneath it.
Oh,
We'll say that you can, eventually, if you dissect down, you can visualize the bullet.
okay. All right. So then, okay, so I need to go underneath it. Is that what you're getting at here?
Correct. Often, even if the bullet comes in straight, it's deflected either by muscle or bone. So generally will not be underneath a bone unless it's lodged in it.
Right. Okay. Well, then what I would do is I would probably make a slight incision to help extract the round. That way I'm not having to dig through the same hole that it went through, correct?
Not necessarily. Often we can use the same way it went in. This is where blunt dissection comes in. So you'll use a surgical elevator, which is sort of a long, thin and flattish bit of metal that you can use to sort of move things out of the way as you need.
Right. Okay. And I can do that, and then as I'm doing that, I would then use some, I would assume, some forceps to get in there and retrieve that bullet out.
Mm-hmm. Anything else you're looking for?
Well, I'm also looking, well, as I'm doing that, I'm also looking to see if there's any damage to the muscle and whatnot, which we already know from the dark red blood. So as I'm extracting it, I'm also looking at what may need to occur after it's out.
Okay, well, you don't see, you see the bullet, muscle
Right.
damage as expected, and it's lodged in the subclavian artery. That was the
Oh,
special placement that I was getting at. So you'll also want to make
my
sure that
goodness.
it's not impacting other anatomy nearby, any vasculature like veins or arteries, stuff like that.
Right. Okay. So okay, the artery is it has been clipped, correct?
We'll say it is pinched. Clearly, from where the bullet is lodged, it's holding it in place. If you would have yanked it out,
Okay. Oh God. Okay. All
yeah.
right. I see. Thank you very much for that.
You're very welcome. But you got it in time, which is great.
Good. Good. So with wound like that, would I need to do anything with it now, or am I kind of just praising my lucky stars that it wasn't damaged and it's just pinched right now?
Oh, it's probably damaged. It's gonna need repair. But
Okay.
you have the time to prepare ahead of time. So you know that there is blood flow to it. You can see that, you know, on one side it looks viable, and on the other side it's the artery is darker than normal. It doesn't look like it's filling at full pressure. So you know there's a leak. You know it's pinched right now. You have some time to plan ahead before you take the bullet out.
All right. Now I'm completely lost as to what I'm doing right now. Oh, I might need some help talking through this.
Yeah, no, this is exactly what it's for. Okay, so you imagine that there is a long sausage casing, and there's sausage spilling out of the casing. How would you stop it in the absence of anything blocking the middle? Or if it was a normal artery that was bleeding, what would you do to stop it?
Well, I would probably clamp it on each side.
Beautiful, absolutely. If we clamp it,
Oh, okay.
we reduce the pressure, and then you can remove it with less concern.
Right, okay. So that's what I would do. I would clamp it, and then let's get to the repair. And in what way am I repairing a pinched artery like that?
Tough to see until you pull out the bullet itself. But a question on clamping for you: which clamp would you put on first? The one
You're gonna
proximal,
put,
closer, or distal, further away?
I would say distal. Huh. I don't know if that was correct.
What's the rationale there?
Distal because well, it's further away from the heart, and so there's not going to be as much pressure.
Oh, sorry. The answer is proximal, closer. Think closest to the art first. Because if we clamp after the nick or damage, it's going to be like a dam building up behind it.
Oh, right.
And blow out
Right.
anything that remains. So it'll make actually damage worse. So
Right, okay.
first contain the bleeding and then clamp the other side of it.
Right, okay. So I would clamp the side that's closest to the heart
Mhm.
first, and then if there was anything in the way, get it out of the way, and then clamp the other side.
I would clamp, place both clamps before removing what is in the middle. But because you've clamped closest to the art first, there's no pressure on the object or the damaged area of the artery.
Right, okay.
So we'll say that your clamps go on beautifully, and you are okay to remove.
Okay, all right. And then at that point, am I taking out a section of this and suturing it, or what am I doing here?
So let's say once you remove the claw, the bullet. This is a gun-toting cougar. We'll say that there is damage to it, but it looks repairable.
Okay, all right. Then I would start repairing it. If it needed a stitch, I could stitch it.
Mm-hmm. What stitch are you going to use, and what material?
Well, I would probably use a cat gut. And the stitch that I would use would be a what was the other one you told me about, Cam? It's not the cross stitch, it's the other one. The I can't remember.
The uninterrupted?
This one, yeah, the uninterrupted stitch. That's the one I think I should use here.
Cam, what would you use and why?
I would use the spell stitch because it's fragile.
And with what material?
Together more. Catgut?
Cam! Cameron! What does catgut do when it sets?
It dissolves, doesn't it?
It gets hard. It holds things in place.
Oh, yeah.
We don't want anyone walking around with hard arteries. It is surgical silk. And the spiral suture. This is particular for the arteries. Oftentimes, catgut will be, replaceable with silk for closing up the outside of a wound. But for an artery or anything delicate internal, silk is the way to go.
You know how you do something a million times and then you just and you don't think about it? Yep. I'll check the tip line, make sure no one's dying in the crossing.
Thank you, Cam.
Okay, so I would do a spiral stitch.
Mm-hmm. For this, it's a continuous series of bites, each slightly offset, and that creates a sort of spiral along the wound.
Okay, so I'm completely lost as to what I'm doing here.
So right now you have both clamps in place. You've taken out the bullet, and there was a bit of artery to repair. The best way to do that, and the way that the department recommends, is by threading surgical silk onto your needle and applying a spiral suture.
Okay, all right. So I would prepare that. I would prepare the needle and the thread, and I would perform a spiral suture on the artery itself at the damaged location.
Beautiful. And the damage looks repaired. So now you need, and we'll assume at some point in the future we will talk you through a spiral suture in a little more detail, but the repair works swimmingly. So now you can unclamp, which leaves us the question, in what order would we unclamp clamps?
Well, you're going to do it the reverse. You're going to do the distal side first because of the same issue. If you release the side closest to the heart, all that pressure is going to come rushing in again, and you run the risk of busting through the sutures you just made.
Beautiful. The artery starts to flush through, and it looks like it has a good color again. The repair looks beautiful.
Good. Fantastic. All right. Is
Well
there
done.
any other... Thank you very much. I did that all on my own.
You did. It was wonderful.
Yeah. With no help either. Anyway, I'm now going to check. Is there any other interior damage other than the chipped clavicle?
You see that there is some internal suturing that needs to be done to close up the muscle.
Right. Okay. So I would do that.
Mhm.
Yeah.
Just before you do, if there was a tiny chip, any idea on repair there?
I mean, you can always do the bone paste. You can put like a small bit of bone paste on it, and that'll help it maintain its structural integrity as far as it is now. And hopefully it won't break any further, right?
Breaking any further, and I would always check if there's anything jagged. Do we think it's going to cause more damage to surrounding anatomy? If it's just a small chip, and at the very least, we might file down around the edges to make sure it's smooth. But bone-based repair sounds good. So you do that. A little bit of muscle left over.
Right. And Cam did tell me this. He definitely told me about filing the bone down and whatnot. I'm just a little foolish and forgot that, okay?
No.
This is not indicative of my teachers.
No, it's okay. We did then go to a very bad call. It's okay.
That, and you're going to
Right.
hear things multiple times over your training. That is because the second you are pushed out of the little baby bird nest and have your first shift alone, it's all going to leave your mind. So we're doing our best now to make sure it's at least been out a few times.
Right. Okay, I'm glad that I'm not the only one that immediately forgets things.
No. So, suturing muscle. What material are we using? And what suture would you like to use?
No, the suture is an uninterrupted. That's the one I'm going to use because muscle is moving a lot.
Mm-hmm.
And then the material that I would use, I believe silk is the correct answer on this one.
Yeah. For muscle, you could use catgut or silk. Either one is completely acceptable.
Right. Okay. I'm going to use silk because was right and it wasn't wrong.
Absolutely.
That one is typically up to your preference.
Right. Okay. So then I'm going to use the uninterrupted stitch to stitch the muscle with silk thread.
Beautiful. Everything reapproximates beautifully.
Oh, fantastic. That's great news.
I mean, the local nurse is impressed. It's the best suturing she's ever seen. Ever since a young Claire Corbin came to the crossing.
You're very humble, aren't you?
Absolutely. Known for it. Yeah.
Uh-huh. Yeah. Sure.
Okay.
She's also known for not dramatic.
I'm never dramatic. What are you talking about?
Oh,
Never.
no, it's not. She doesn't carry around fake blood to then throw on herself and ruin her own clothes
You
at all.
have to be ready.
You're not wrong.
Toting Cougar.
Okay. Yeah, for a gun-toting. Good. All right. So the muscle damage, the bone damage, and the bullet's been extracted. The artery's been repaired. Now we're looking at closing up this wound.
Mm-hmm.
So I reckon we can do a just
Also,
a
question.
I'm sorry.
A reverse going back a few steps question. What did you use to flush out the wound and clean it?
I was using saline.
Okay. Anything else you might
Well,
consider?
well, I mean, I can also use lavender water as well.
Beautiful. Why would you use lavender water?
Lavender water is a little more gentle, if I remember correctly.
Lavender water is an antiseptic.
Oh, there you go.
And importantly, gentle enough to use for internal work. Like if you're doing surgery on an organ, you could still use lavender water. But carbolic acid, which is another antiseptic, that is more so used for cleaning tools or on the skin externally. But lavender water can be used internally as an antiseptic.
Bonus, it smells nice.
And,
That's true.
Well, it's heavily alcoholic, so there's there is some scent of
There is a little
essence.
bit of scent.
It's
but
true.
please
Claire,
don't
it's
sniff
true.
it and burn your nostrils.
I wasn't gonna. I didn't mean. That's not
You
what I meant.
lavender water sniffer. Okay, refocus. You're closing. You've closed
my God.
beautifully. The wound comes together.
Oh, right. Okay. Oh, I'm so sorry.
Oh, yeah,
Got a little
wow.
excited there. Yeah, I got a little excited to close up this wound. It closes. I use a cross stitch. I'm probably going to use horsehair thread because that's what I want. Oh, my goodness gracious. This leg is busted all to heck. Let's move to the leg now.
Are you done with this one up here?
I just closed you up.
What's left? You want your new world to
I
be
could
immediately
bandage you.
infected?
I bandage you. Oh, no, I don't. All right, I don't.
Okay, so then what are you going to do about it?
That's what I'm going to do. I'm probably going to put a little bit of iodine on it. And then I'm going to wrap you in some bandages.
Where are you putting the iodine?
I'm going to put it on the gauze that I'm going to put over the wound. I feel like that was an incorrect answer.
So, whenever we apply anything, like a salve or an ointment, it's around the sutures, not over them.
Okay.
It will degrade the sutures quicker than they normally would.
Right. Okay.
So, some iodine is completely fine. Cam, what would you use most often?
Salve.
What's in it?
That we have.
Mm-hmm.
I know honey. And I
Beautiful.
know there's another thing.
Yeah,
I
good
wanna
answer.
say that it's lavender.
Beautiful. You could use a honey salve. You could use a honey lavender salve. Quite commonly, with the department, you'll get calendula or marigold. Marigold and honey is most often the salve of choice. Marigold helps with scarring, and the honey is ... from
Sweet.
ancient times, used in Egypt because it is antiseptic.
There it is. That's the one. See, I knew that.
Yeah, everyone knew that. Parfait. So, honey and
Of
calendula.
course. Right.
Calendula helps tone the skin and helps reduce scarring.
Oh. So that's another one that I could have used for a previous patient that had the laceration on her forehead.
Oh, yes, absolutely.
Yeah, I mean, it was the honey lavender that I gave you because that's typically what I use. But
Right.
Well, and I mean, so much of this, Mr. Bixby, is a preference, too. So I'm just trying to elucidate some many options that you have, and you can pick your favorite.
Right. Okay. My favorite one's the correct one.
well, they're all correct.
So the department standard would be the marigold and honey.
Okay. All right. Marigold and honey.
And then
I'm gonna
you-
apply that
you-
around. the
Around,
features.
beautiful, and then I'm wrapped up nice and snug. Parfait.
That's right. Nice and snug. Okay.
Ah,
Are
my
we ready
leg!
to move
Oh
on?
my God, my leg! Ah!
I knew it. All right. So we're gonna look at this leg. Is there bone protruding out of it?
Actually, great point. I'm in so much pain.
Okay. All right. So can use, if you're not allergic to it, we can use the grapeseed extract. Or do you think I should just go straight for the quercetin and put it in your thigh?
Okay, well, okay, why would you give quercetin?
Or did I say the wrong one?
No, you're good. Why would you give quercetin?
I thought it was like a milder pain reliever.
No, it is not. Which is, and I know you haven't. No one's gone through the medication with you yet. This is doing some of the work now. So when you think of quercetin, think of regaining balance to the body. Whenever, say, for example, there's a cutting off of an artery, and the body suddenly loses blood flow to some major part of it, it can go into shock. Now, there are other ways that happens, exposure to cold or extreme warmth, and blood loss, like I mentioned, allergies, poisonings, all of these have the potential to send the body into shock, and quercetin works to combat that. So it's not something we check for allergies for. This will stick in your mind. It was given to me by Dr. Trix, one of my senior doctors.
Yes.
If you're allergic to quercetin, God wants you to die.
Right. Okay.
So
they're cursed.
So they're cursed. Yes, think of quercetin. And just in case you don't have the spelling in mind, Quercetin. Quercetin.
Yeah, I learned that the other day when we were in Saint Denis. I couldn't find the bottle spelled Kercitin.
It's quite common. Don't worry about it. So, especially as a trainee, one of the first things you can do when you arrive on scene is offer to administer quercetin. If there's been blood loss, or so a gunshot, anything like that, that can be your primary first port of call. So because I lost a lot of blood, I would have given me quercetin already. How do you administer quercetin?
In the thigh.
Beautiful. Intravascular in the thigh, usually.
That's right. And I probably wouldn't give it to you in the one that's broken.
Yeah, that's solid. Solid reasoning. Yep,
That's
I
good.
like
That's
it.
good.
I like it.
Good.
Ow, I'm in so
Okay,
much
good.
pain.
Okay, all right.
Okay, what's helpful in
You're right.
judging what to give for pain? Partially how much pain they're in now, but how much pain they're about to be in, given what treatment you likely have to do.
Oh, you're probably going to be screaming your head off if you're already in pain.
Yeah, so this is 10 out of 10. Resetting a broken bone is some of the worst pain you can experience. I would give morphine.
Right. Morphine, all right.
So morphine is one of the strongest medications that we have. It does also manifest in a few different ways. So you could think of laudanum, for example, where it's diluted with alcohol, or even less refined as something like a poppy tea, where it hasn't been made into an opioid yet. Give it the minimum possible, but cover the pain. It's a tool that we have. Some folks are adverse to it. If they're conscious and they let you know, absolutely respect their wishes. Check their chart to see if they have an aversion noted. If none of that is possible, give them morphine.
Right, okay. So I'm going to give you some morphine.
Hell yeah! I'm gonna be loopy.
Hell yeah. That's right. You sure are.
I suppose one unique part of the crossing with morphine, a warning that I do give, if they are a wanted criminal who's been taken in, and it is imperative that they are conscious and are able to speak with deputies, grapeseed extract is comparable and will not cause that same kind of mental fogginess or disassociation. So if it is, going to save someone's life, go with the grapeseed.
Right, okay.
Yeah.
So in this situation, are you wanted?
I'm Corbin. No. I'm not Corbin. I look exactly like her, but she's an outlaw. Oh. So I'm not her. It is safe to give me morphine.
All right. Then I would give you morphine in a drip, reckon.
Can also do intravenous.
Oh, okay. I mean, which one do you use? Which one do you two prefer?
So, for me, it's a matter of efficiency. If I already have a line with a bottle with saline, I would add the morphine into that line. Otherwise, usually intramuscular is quicker. Or sorry, intravenous with an injection.
Right. I'm probably going to do that then. I'm going to just give it to you in the intravenous.
Okay, perfect. I look so calm. You've never seen Claire Corbin this calm.
Good. That's surprising, actually. Yeah, and I would do it in the same leg that I did the quercetin. Alrighty. Now, looking at this leg, let's take a look at it. It's obviously broken. Did you say if it was a compound fracture or not?
You have yet to look at it. So,
all right, I'm looking real hard.
All right, it is. Let's go.
I have no problems cutting off your leg, by the way.
Good. I like to hear it. We are gonna go with a more common. You'll see the fibula broken than the tibia. Just tibia because it's the tibia is a little bit of a larger bone. So we'll go. It is a full break to the fibula.
Alrighty. It's a full break to the fibula.
Correct.
That's right. I just said exactly what you said to me. So I'm doing pretty good. All right. At this point. Oh damn! This fibula is really broken. Okay, so we're gonna need to reset it. I don't exactly know, other than, trying to line it up the best I can. What would be the best way of doing that?
Okay, so the phrase to keep in mind is open reduction. So that's putting the bone in place. We're going to have to do that surgically. So open it up, get a good look, get it back in place. And then internal fixation, where we're going to use, depending on the bone, a combination of plates, screws, rods, wire, and pin, depending, like I say, on where it happens, to internally fix the bone in place.
All right. So when you are making the incision to look and get a better look and see where, like what you're going to need to do, where are you cutting at? Are you cutting on the side of the leg? Are you cutting on the back? Where?
I would elongate, because this is an open fracture. It's broken the skin. We are going to just use what the injury has given us and widen that above and below the cut. So just trying to minimize the arm while we can.
Right. Okay. All right. So I'm going to cut almost along the broken bone. Is that what you're saying?
If it will not say open, as this one is, you could get away with just reducing the fracture by traction on say the foot and the hip held in place. This one we will have to open it up. There's no way around it.
Right. Okay. So I would cut along the wound itself to open it up and get a better look.
That's right.
Right. And how is it looking on the inside, would you say?
So the reason it's an open fracture, things are pretty jagged. When it snapped from clearly the cougar hitting it full body and sending me flying after it shot me, there are some fragments of bone.
Okay,
so it's
fragments of bone.
Partially, we would call it comminuted. Partial comminution of the bone.
Alrighty. Oh my goodness, this leg is comminuted.
Ooh.
We need to extract some of these bone fragments out of here before we to reset it. So, This is also a wound. It was an open wound. So would you take this as an opportunity to flush it out as well with the lavender water?
Absolutely. Anything that becomes open needs to be cleaned thoroughly.
Right. So I'm gonna flush it. I'm gonna be looking for this debris coming out of there, which would be these bone fragments. And then I'm gonna examine, are there any other bone fragments that need to be extracted that are still in there?
No, you clear them all out. There are a few that are
Fantastic.
too small, shattered thoroughly. So there are a few pieces that you could probably use for reconstruction, but several that are too small.
Right. Okay. Then I'm going to prepare both sides of this broken fibula to be.
Oh, just resupplying
hello.
probably.
Hello.
Yeah.
Howdy.
Right. So I'm going to use a file, get both of these sides prepared because they're probably jagged, like you said, from shattering like they did. I'm going to use some of those smaller pieces if I can to fill in some of the gaps if there are larger ones. And I'm going to do that by using the bone paste. And then as I'm maneuvering this bone back into place, I'm probably going to need to use some plates and screws, or pins and screws, excuse me, to help realign it and get it back in the right place. Is that correct?
Yeah, so I would use pin and wire for something like this, along with the bone paste to sort of stabilize it. It's a little small to be inserting anything into it, but if you had something like the femur, a significant rod could be put in place to hold things stable.
Right, okay. Okay, so you would use plate and wire, is that what you said?
Pin and wire.
A pin and wire, excuse me. I'm ripping over my own mouth here. So I would use pin and wire to help get it back into place. And anywhere where those two bones can make contact, I'm going to be using bone paste to help give it a little bit more of a structural integrity. Is that correct?
Yeah, perfect. So either you are drilling a hole to put the pin in place, or even if it is truly a tiny bone, you can also wrap it with the wire.
Right. I know you you can't see the inside of my head and whatnot, but I have the idea in my head that these bones have wire going around both of them. And the pin is kind of holding them together, and this wire is giving them a bit of like a support.
Yes, I think that would be acceptable. Frequently you'll see pins being put in place to anchor wire, so that when you twist the wire, it pulls the pins together, offering a traction for the bone. Or depending on the way that the bone is broken, it would not be uncommon to just wrap the wire directly on the bone.
Right. Okay. And I'm wrapping it rather tightly because it's gonna need to be very tight and very it's gonna have to give it the adequate space to both heal but also hold it in place.
Regardless, most of the time you will have to use a small bone drill for example, I just did a repair of a knee, the patella that had fractured. There were enough pieces to put together, so we did a series of bore holes into the various ends of each of the bones and wrapped the wire to pull them together. That's a great example of that sort of theoretical approach.
Right. Okay.
Or the ribs.
The ribs as well.
Well, it depends on how bad the break is. I have I have pins and wires on one of my ribs, and also my wrist, I think. But
my God.
I have bad luck when it comes to wildlife and falling down slight inclines.
Well, apparently so does Claire here.
She has
I
problems with gun wielding.
sometimes there's a bear, you know, and it spooks your horse. That's about it.
And gun-wielding cougars and whatnot.
Hello.
But let's say you fix it all up there. You'll get practice
Right.
with fractures, and we can talk you through the different kinds.
Right, of course. And then I need to close you up a bit, you know. Oh, well, I guess I should ask: Does everything hold? properly?
Absolutely, looks great.
Okay. All right. Fantastic. There's no other interior damage, correct?
Realistically, oh, go for it.
She asked if he smoked and wanted to buy cigarettes, but she's
Oh,
gone.
no, I despise it.
I hear a lot of horses or a wagon.
Let me finish. Quick,
Anyways.
go.
Probably the wagon.
All right, you close it up.
I'm sorry.
What?
I close it up.
Yeah.
I'm going to suture you. I'm going to apply this. You say honey magnolia salve around the
Marigold.
suture. Marigold. I'm sorry. What did I say?
Magnolia.
Same, different. You know?
It certainly is not.
You're not wrong. Marigold. So around the sutures, and then I'm going to wrap it, and then I'm also going to put a splint on this. I don't want you to just be willy-nilly out here, so I would probably put a splint on it and wrap that tightly as well.
Okay, for a full fracture where it's broken skin, and you needed to do significant repair, sometimes you may be able to get away with a splint. I would recommend casting it.
Okay, all right. And how are you all making your casts?
Plaster.
Well, I mean, yes, but how are you? What does the process look like?
Oh, of course. So you could have the local nurse start mixing up the plaster for you and getting the bandages ready. You're going to put some sort of padding down after you decide how you are going to cast it. For the most part, you are going to look for the joints above and below where the break happened. So for something in the shin, where would you put the cast?
Well, I'm probably going to put the cast. It's going to go up to the knee, not over it.
Mm-hmm.
It's going to go below the ankle. So they're going to have a cast along their foot, over the ankle, up their shin, and up to the knee.
Beautiful. Yeah, absolutely. Toesies to their knee is perfect. Where my boots are, essentially,
perfect.
with the toes cut off.
Exactly. Yes. Except I'm not going to cut your toes off.
So you could wrap it loosely with some gauze batting, and then you are going to wrap bandages soaked in plaster around to create the cast.
Right. And then once that's in place and it's dry, then they're good to go.
Yes, theoretically, in a perfect world, we would love to rest them absolutely with traction on it for 3 weeks or so. But often you'll give them some crutches and they would be out the door.
Yeah, we both know they're going to be out there, you know, doing whatever they're doing, having fun.
Yeah.
Almost immediately afterwards.
Mm.
Getting shot again.
Probably falling off horses onto it as well.
Now, if they are an outlaw, we have very little power to stop that. If they are a deputy or a ranger or another fellow colleague in the Department of Health, and you give an order for strict rest, they must follow that. So if you see them out...
really? We get to tell the deputies what to do?
Yes, sir. And if you see them disregarding a direct order that you've given them, that is for the benefit of their health, you tell us senior staff right away.
Right, okay. And I'm sure there's going to be lots more training and whatnot, even when, especially when I get the clipboard and everything. So I look forward to this.
All right.
Shall I
Pretty much not stop learning.
Oh, of course not. Shall I help you to your feet, Claire? Or you just
Well,
are you
I
fine laying
passed out
down
because you said that the it was comminuted. So what signs are you looking at for me to be waking up?
Well, I'm first of all, if your eyes are fluttering open, then obviously you're conscious and you're awake. If your eyes are closed and they are not fluttering, I'm going to probably look at your pupils.
Good, reactive, beautiful. Say there aren't signs of me waking up. What are next steps? Not that I've died,
If there
just
aren't
that I
signs of
need
you-
rest.
Right. If you if you aren't waking up and whatnot, I'm constantly going to be checking your vitals, your breathing, your pulse, things like that. Right. I'm going to be watching for things that I may need to be more worried about that may indicate a more serious situation.
Okay,
I'm
imagine
gonna
in
assume
this
that your
case,
breathing's fine.
absolutely. Assume that I am perfectly stable, but I'm still not woken up. Cam, what would you ask in this
Well,
situation?
I would check to see if she hit her head at all.
Didn't hit my head. I'm stable.
Well,
You've tweeted everything.
listen. Right? What?
She's fainted.
I'm still unconscious. I might need more rest. What are you going to ask? Perhaps of the local staff.
Oh, well, I would ask the local staff if it's possible for them to stay in a bed overnight or until they feel well enough to go on their own.
Perfect. Beautiful. That's what I was looking for. Okay, well, they cart old Claire Corbin's dust bones up to the wall to stay the night.
All right, get in that bed over there, you. Perfect, like an angel. And then local nurses, if you would just look after her and whatnot. If she does release herself from the medical ward, if you could let us know, we would greatly appreciate it so that we can try and have a follow-up with her. Thank you.
And then, because we've kept her overnight, what are we gonna do?
Oh, well, you're going to document this. You're documenting everything.
Well, yes, but also,
You've kept her overnight.
mm-hmm.
I mean, you're also going to notify her next of kin and whatnot.
Correct.
Yes! Very good! Excellent! Wonderful! That's a tricky one.
Thank you very much.
Very good.
Yeah, anytime we gotta keep someone overnight, we look in their file and see who, if they have a next of kin, let them know. So they're not
Isn't it
out there worrying about their.
Isn't it
Okay.
also, if they are unconscious in your care, you can also notify the next of kin?
Truly, anytime there's a
if they-
significant injury,
Yeah, pretty
Yeah.
much. Yeah.
All right.
I would never not notify a next of kin, unless I was giving express information by, say, a deputy that something was wrong.
Right.
And it's something that even you can offer, if they just need to go off and rest for a little bit, but you're conscious and they are conscious and speaking to you. If you have the time, it's a slower shift. You can offer to send those telegrams, even if they are conscious.
Right. Okay.
Okay, emergency first aid
And if
knowledge check.
And if they don't have a next of kin, it's very, 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 very important to not to tell them, to ask them if they want to add a next of kin and explain why it is helpful to have that. Although we are having an event on the 19th of July that Medic Sun is running.
Oh.
Where blood testing, allergy testing, and next of kin adding. on a train, which will probably end up being the very first time in the crossing I go on a train.
I'm so excited for you, Gam.
Oh, you know who's gonna be there?
Oh. Okay, focus. Hold on. Okay. Emergency first aid.
Right.
You're evaluating the situation. You are acknowledging that the safety of everyone present is the most important. You looked for the Cougar, but you didn't expect a gun. So a little bit of a minus point there, but pretty good.
Well, yes, of course.
Well, now you know. Check vitals. You did that beautifully. Pulse and breathing. You evaluated for injuries. I suppose one thing.
I can't.
If you did suspect that the breathing was compromised, I was just putting them into the recovery position on their side. But my breathing was slow, but not obstructed in any way. So, but just the foreknowledge to know if there is issues with the airway to turn them over. Now
Right.
we
Like James Carley.
Yeah, shortly before he passed.
Oh.
Wow.
Because you were right here, and we didn't roleplay having to move them anywhere. We didn't have to pack the wounds. But there is the potential, especially if you are ever out on patrol with the rangers, that you find someone, you just start treatment and evaluate them before moving them. Now, in that case, we would pack the wounds. There you are using the pressure of bandages stuffed into the wound to cease any bleeding. We never remove packing until we are in a medical office. If it starts to bleed through, instruct anyone helping you to simply pack more in. Never remove packing until you're ready to repair it.
Right. Okay.
You would get medication on board and then continue treatment. So, very important, start with the vitals, because unfortunately there's not much we can do for someone who doesn't have a pulse.
That's true.
Figure out the major wounds, staunch bleeding if you can, address airway if needed. Go to medication next, treat for pain, and then continue treatment. That is the procedure for every person that you encounter.
Alrighty.
Okay. Now, we can, I think, probably attach reviving patients to this. Now, the first thing you do, I suppose even before you start anything else, is get the patient comfortable. Make sure that they are at least started in that process before you start your treatment. That just speeds things along later. Okay, so lower pulse. If someone's pulse starts dropping very rapidly, what's your tactic to address it? There's a few answers here.
If the pulse has dropped, well, you say there's a few answers. I'm having a hard time coming up with one.
So if you start losing a pulse, there is, well, I suppose two major streams. There is something potentially mechanically wrong. We've missed some injury. They are bleeding out. There are simply less pressure of blood in the body. But we can also take a route of administering medication to raise the pulse again. Now, a few options there is a solution of cocaine. Or in the most dire circumstances, we have access in medical offices only to adrenaline.
Alrighty.
So those can kick up a pulse, but if you're doing that and there is a mechanical issue, all we're doing is pumping out blood faster. So pack, clamp, repair, and then try your best to raise the pulse again.
So when you first respond to a scene, one way that we could minimize that, when we're first responding, we find wounds and we're packing and everything. we're also doing a blood sweep, and would help us to identify some of those mechanical issues that you're talking about. Yeah.
Absolutely. For the most part, there won't be too many hidden injuries. But if you're treating and it's not improving with quercetin with your initial treatment, we could have missed something. So good to check in the boots, underneath the shirt, the back of the head, in the air, if it's been covered. All good places to look.
Right. Okay.
All right. Are you comfortable, both of you? We can skip this for now. Talking about airway treatment.
I'm comfortable talking about it if you want.
Okay. All right. So if someone stops breathing, the first thing we look for is if there's any obstruction. Now, this could be something material, or it could be a bodily fluid like blood or mucus. So the first thing we do is clear that out, encourage them to cough if they are lucid. Otherwise, we can roll them over on their side. Anything we can do to clear that airway. Of course, if it's blood, treating the source of the blood becomes the primary way that we store that breathing. Now this is another one where you have to weigh the pros and cons of doing the surgery. It is possible to perform a tracheotomy if you cannot at any way restore the breathing of a patient. Absolutely an emergency procedure because the infection risk is so high. Of course, this is where we create our own airway.
What are you using? Once you have created the opening, what are you using in order to create that airway?
So the first thing I would do is insert a speculum that opens it up, or a dilator after making the incision with a scalpel. That is just to clear the pathway. And then you would insert a cannula, so a tube. They're curved metal with a sort of flange at the base, so it does not slip into the incision point. Mm-hmm.
Right.
So, not pleasant. Emergency life-saving, and to give us enough time to repair. Importantly, with the lungs, we have two of them. So if one lung is damaged and looks quite dire, and the other one is in good condition, there is a chance that we could, drain the halfway good lung and get that going, giving us some time to repair the other.
Now you have to remind me, are we rolling them onto the side of the damaged lung or of the good lung?
To be quite honest, if both lungs are damaged, it's whatever gives you the best operating space.
Right.
You just want to treat the lung damage quick as you can. Try your best to make a quick call if one looks very damaged, to go for the good one first. You could inflate it if you needed to. If it's lost pressure, train it if you have to. Restoring one lung is and losing the other is better than having no lungs at all.
This is true. People need to breathe.
As you likely saw the other day, if all of our treatments are to no avail and you do not feel a pulse, please stop treatment immediately. If things are touch and go, which they can be, say the art rate is capricious and pauses a moment or seems rather erratic, there may be some room for a round of compressions. But that is it is very rare to have an art presume beating on its own. So just keep the rule of thumb in mind that if there is no pulse, we stop all life-saving measures and confirm the time of death. Now, I believe you're certifying as a medic, so you'll be able to write death certificates. Doctors and seniors can sign them. So that's a chance for us just to make sure we know what's happening with you, go over anything if you have any questions, and just give things a quick double check.
Right.
After that, of course, is notifying next of kin.
Now, do you have a template for that kind of thing?
We do, yes. That will be in the files as soon as you are certified.
Lovely.
All right. I think I hear the bell ringing. Cam, do you want to escape to bed?
Oh. Yes, I do.
Okay, parfait. What about you, Mr. Bigsby?
I'm with you, if that's all right.
Absolutely. Let's have one adventure, then I gotta clock off.
Okie dokie.
Thanks for helping with Cougar, Joel, Cam.
Thanks, Cam.
Of course.
I'm so excited for you.
I know.
I gotta keep it together. Okay.
Yeah, don't throw yourself off your horse.
I will try not to. Okay, look at the tip, Claire. Oh, don't get excited about Cam's dating life. Oh.
What's it say? What's it say?
Okay. We are going to Valentine.
Alrighty.
There is one person injured.
Alrighty. Here we go. I'm assuming we just go. We don't have to worry about the tips, right?
What do you mean about the tips?
I mean, we don't have to send a tip that we're responding to.
Oh, no, I believe
tip.
it's, okay. Claire Corbin with senior hat says, yes, we should still send a tip, theoretically, to say we clocked in on Backwater, we're doing the Cougar drill, and then another tip that we're going. But we are marked as responding to it, or at least I am, and they'll know that I'm with you. So, we are accounted for.
Are you alright taking shortcuts?
Oh, please do. Yes, the path of an herbalist is never a straight one. But this is interesting.
What, you've never been down here before?
Never to cross, no. A little further towards the water, I suppose.
You're gonna get a little wet here.
Okay. Ooh.
Yeah, it's enough to wake you up in the morning.
It certainly is. Okay, we get there. Someone is unconscious on the floor. What is the first thing that you're gonna do?
Well, we're gonna check the vitals first.
Yeah, beautiful. You check vitals. I'm gonna look for injuries.
Okie dokie, can do that. And if they are if they're not breathing, that's one thing. But if there's no pulse, then I just notify you, and that's it.
Absolutely. Otherwise, you'll give the status of the patient, and then we'll make a decision together about medication.
Right. Are you an herbalist? Is that what you said?
Correct. Once
Well,
you
I
have
like
your
herbs.
once you have your sash in the Strawberry Medical Office, I have 2 volumes of medical herbalism for you to peruse at your leisure.
Oh, I would love to do that. I'm actually going to be trying to make some of those medicated bandages.
Oh, lovely.
People keep complaining that it's so much work and that you don't get much out of it and whatnot. But I think I'll give it a go, and I'll be the deciding factor on that.
Oh, parfait. Well, good. Do you want to suss out the recipe yourself, or have some guidance?
I actually spoke with the Rangers. I forget her name. I want to say Crow.
Oh, Game Warden
I spoke with-
Avon Crow?
Well, yeah, this is the one. Yeah, I spoke with her. She actually gave me the ingredients that I need to do such.
Beautiful. It's excellent to start meeting folks in different departments.
Right. I don't know too many deputies as of yet. I did my registry with a senior deputy Medina, but other than that, that's about all. And we treated. I say we treated. We looked at some deputies yesterday. Or not yesterday, the day before yesterday. Teddy May and Elizabeth O'Flynn, I believe. Fastest medics in the West. Here we are. And they're gone. Claire?
Oh, I am so sorry. Go ahead and check if they're in the sheriff's office. I will see if they're on the back here.
All right.
I was yammering and muted. No. 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 They're back here.
The hell you think you're doing?
Oh, okay.
God damn it!
Oh, excuse the hell out of me, sir.
Okay, hello, my dears. What's going on?
I do. Man on the floor's dead. Bullet wound to the head, I believe.
Do you know the man's name?
Not really, it was all very fast. I think Sylvia said it was something along the lines of million something or other. Apparently he's been seen by medics before, but I don't know.
It was myself. I believe he's wearing different clothes, but I recognize the glasses. Okay.
Right, he's got a gunshot wound over here.
Yeah.
I'm gonna let you take primary here, okay?
Absolutely. Can you get started on medications?
Absolutely.
And just talk through what you're doing, and if there's anything I cannot choke.
All right, so I have some quercetin here. I'm going to go ahead and give you some of that. And you might feel a slight pinch, but I'm doing that. I would like you to measure your pain level from 1 to 10, please.
Oh, I mean, right now we're talking a strong, probably a 7 or an 8, you know.
All right.
Well, I mean, that'll maybe add a pinch onto it when you stab that into me 5, bloody hell.
Adds about 1 or 2, I would say.
Well, that would take it to 10, and I think that would be maybe quite dramatic for this. Ugh.
A little bit.
Alright. Any allergy to grapeseed extract that you know of?
Not as far as I'm aware, no.
Alright.
Alrighty. I'm going to administer that one next, alright?
Absolutely. So one thing we want to make sure is that we just give a quick wipe of the site. And then we're also going to give a little bit of a warning unless the patient tells us that they wouldn't like one.
Do you want warnings?
Just go for it. I've got a bullet in my shoulder. I think I'm ready for whatever else comes at this point. I don't think it's gonna all the way through either.
All right, good, because I'm just gonna. There it is.
Oh, yep, felt that.
Uh-huh.
All right,
It's one
unfortunately...
thing that this...
Oh, go ahead.
Go ahead. No, go ahead.
We're going to have to damage your jacket a little bit here. If it's lodged in there, we need a clean site. So we'll have to cut it a little bit more than it's already damaged.
Just doing what you need, Doctor. What's your name, by the way?
I'm sorry, I was going to say, I believe you're a detective, are you not?
Yep, Senior Detective Lindsay.
Lindsay, that's right. I'm Senior Dr. Corbin, and with me is Trainee Bigsby today. Hello,
That's
Bartos.
right.
I do to the pair on you. Sylvia, Dr. Corbin affirmed it's that million, wherever his name is.
$1 million banks.
Okay,
Yeah.
understood. I never got past his first name being Million. Okay. Bigsby, can I get you to get a set of retractors? I'm gonna numb the area with cocaine paste, and you're gonna insert them so we can get a clear view of this bullet.
Right, okay. Let me grab them right over here.
Alright, and hopefully that grapeseed kicks in pretty quickly to take most of the edge off. Lindsay, were you injured in a fight with Mr. Million?
Yep. He was running moonshine and denied it, and then decided to get off of his wagon, pull a gun on me, and say that if Sylvia didn't put her gun down, he was going to shoot me in 3 seconds. And he reached the end of his 3 seconds and tried to shoot me. Well, he did shoot me.
All right, then. Here we are. How's that? Is that you seeing there?
Alright, now fingers crossed this is whole. There is a chance that it could be fragmented. That makes things a little trickier. We'll have to extract those before we start repairing anything. But my fingers are crossed that... Oh, there it is. Let's see. All in one piece. Oh, no. Now a good trick, there it is, okay. It must have hit a bone and fractured in 2 sites.
Oh, bloody hell.
Yeah, not the most ideal, but it's also not in so many tiny pieces or buckshot,
Oh,
where we would have to pull
very
things
far
out one
from
by
ideal.
one over 45 minutes or so. But okay,
Oh,
so
Jesus,
in the
don't
shoulder...
scare me like that, Doctor.
Well, think
Bloody
about
hell.
it. You're in the best case scenario. Now, of course, the same subclavian artery that we were concerned about with the gun-toting Cougar, Mr. Bigsby, is the same one that goes down around the shoulder through to the arm. So we are concerned about that artery being there. Would you like to confirm that no other anatomy is in danger with the positioning of the fragments?
Right, of course, I can do that.
You're not going to chop my arm off, are you?
It remains to be seen, but probably not.
Oh, bloody hell, I need this arm.
Well, I'm sure you... have you been shot before?
Unfortunately, yep.
All right. Well, you survived that one. Hopefully, we'll do everything we can to get you through this one, too.
Well, the last time I was shot, it was 4 times in the back and they punctured a lung whilst they were at it. So,
My
That's
goodness.
nothing
I
at
think
all.
I'll take a bullet wound in the shoulder whilst I can still see it. Sorry if I'm being a bit brash. It's not the most painless experience.
No, it's your job to...
No, you're quite all right.
Exactly. Say what you need to say, and our job to make you better.
Trust me, one of the things I can work on the most is probably my bedside manner.
Well, I always try and be nice about it, but I'm sure you can understand why I'm probably a bit annoyed right now.
Of course, of course. Claire, I'm not seeing any further damage by these fragments.
Okay, beautiful. Do you feel comfortable using the forceps to remove them?
Sure, I can do that.
Alright.
I just don't understand why he had to do all that. Why did he have to bloody show all over a few bottle moonshine?
Well, I think even a drop of water is very valuable to the thirsty man in the desert.
Possession of moonshine wouldn't even get you in Sissika. You'd spend it in a local cell.
Even, yeah, exactly. It is just that 25 days.
It's really not even that long. Ugh.
Bit of community service and it would have been gone in jiffy.
Oh, of course,
I
nothing
could have had him.
justifies it.
Could have had him help us make those medicated bandages.
Actually, yeah, that would, yeah.
All right, I got the
Excuse me.
first one out of here. Now let me try and get the second one.
Beautifully done. When I treated Mr. Million, he had an encounter with a bear. I believe day before yesterday, perhaps? No, Thursday morning.
Bloody hell.
So to survive that and then, like you say, throw it away for moonshine. Sometime in a cell. Well, I wish him peace wherever he is.
Oh, one there was a little more difficult.
Hmm.
Let me just make sure that I didn't cause any more damage extracting those. All right.
Absolutely. What you can do, sometimes I wrap a bit of gauze and attach it to the end of the forceps. Also make sure
Right.
everything is very dry. That can help. Also, a trick that a brilliant doctor, another Silas, but Owsley, with his family name, you can take a bit of saline in a syringe and inject it underneath the bullet, and sometimes that can dislodge it.
Right. Okay. Let me see here.
Are you a superstitious man, Detective Lindsay? Would you like the fragments?
No, I've got no reason to keep them, thank you.
It looks like they came out from you, Claire.
I don't like being reminded of me injuries. The scars are enough.
Absolutely. Okay, so we are just gonna check whether or not the trajectory of the bullet caused any damage to the muscle initially. If there are any internal sutures needed. Sometimes it's the case where it hits the muscle fibers in the right way and just separates them, and it's enough that they'll heal on their own. So we'll just check if any internal sutures are needed. If no, we'll go to closing.
Okay.
Let me take a look.
Things that make it a little more likely, where you for sure need to check, is if there's any fragmentation internally. That means the bullet hit with some force and to cause the split, but you never know until you look in there.
Right, of course. Unfortunately, yeah, I think some of these sutures are going to be needed inside. This muscle looks a little damaged.
Bastard.
All right, and what would you like to use to close on the muscle?
Right, I'm going to use an uninterrupted stitch, and I reckon I would probably use some catgut. Thank you very much.
All right, now, with where this is, are you left or right-handed, Detective Lindsay?
I'm right-handed. I'm right-handed. I'm a right-handed man. I've been shot in my left shoulder. I can see you trying to figure out which one. We all got our lefties and our rights mixed up. It's okay.
We call them Australian lefts and right.
All right, now, the uninterrupted is an all right choice. Of course, often it just comes to preference. It's very good, for example, if we're doing something cosmetic, a small cut to the face perhaps. Then we can bury the suture with minimal entry and exit points. Now, for muscle, something interrupted is a little more of a sure bet. That way, if one of them pops, you still have several points where it's connected in.
So you're saying maybe a cross stitch would have been better?
Cross stitch, the mattress is okay. A simple interrupted is also quite strong. That's where you do an individual stitch, you tie it off and move on to your, cut the excess and move to the next location.
Right, okay.
Of course, that
Well,
takes longer. So either way, I think you're fine. Continue on.
Personally, I'd use cotton thread and do a slip stitch so you don't see it, but these ain't clothes, so go for it.
Well, Detective Lindsay, if you are vain enough to think about what your inside muscle looks like. But for the closer,
No, I just
absolutely.
Sorry, you just talking about sewing basically, and well, I am a tailor by trade, so
I was going to ask you. You know your sutures, your stitches.
well, you know, I'm gonna have to. I've got a sewing kit in my saddlebag. I'll have to fix my jacket later.
Right, so
Did you forget that you're a tailor?
But
I think
everything looks
we're
like it's
done
up.
inside of this wound.
Looks beautiful.
Yeah.
Well done. All right. Well, if you're happy with that, can move to close.
Alrighty. So, you're gonna feel a little cheer because I have to pull this wound closed, and then I'm gonna stitch you closed. All right.
There's already some cocaine
go.
paste. It shouldn't be too bad. Not to scare you, Detective
just-
Lindsay.
Just go for it. Just just. At this
Okay.
point,
I am still right here, Mr. Bigsby, if you need anything.
All right. Thank you.
Are you okay to take over transport of the body, if it can be moved?
Yeah, as long as you have confirmed everything on your end, just to all of that, and I can have him moved to Rhodes.
Of course. I'll check, just in case the Undertaker is busy and needs to delay a little bit. But if he is good to go,
Yeah, no worries.
all the injuries were quite apparent, and we unfortunately know what happened.
Okay. As it's everything's on your end, you know, you need what you need.
I'm just gonna check if he has any next of kin. Did you see any when you were?
He doesn't. There was a journal on him, but it seemed like there was more context than, you know, actual next of kin. It was like, oh, this could be a potential person that I could work with, kind of thing. Nothing else. He did have. I did notice that he had like a locket, but I don't know if that has any information. I didn't find any other sort of ID on him.
Yeah.
you know, Mr. Bigsby, I reckon that's holding place just fine.
Yeah, I reckon it will. All right. So what I'm gonna do now is just for the comfort level and whatnot, I'm going to put some marigold salve around it, and I'm gonna put some bandages on you. Okay.
Yeah, that's fine. Just what you need to, lad. You're okay. Doctor, am I signed off as not being able to work for a few days?
As long as you're not placing a long arm against it, I'm not necessarily against you being out there with a sidearm in the uninjured, and I will say I would recommend giving at least tonight a break. If you're feeling all right in the morning.
Go back duty tonight.
Good,
definitely,
good.
But
Then good night's rest. I trust you in your judgment to see if you're okay to go back either partially or at full duty.
okay.
Just be careful mounting a horse. If you pull on it, I'm worried about straining it. So be careful.
Okay.
If you find it is hurting more, if it's uncomfortable, stop. You know yourself best.
Okay. Well, I thank you for your input. Appreciate it.
Of course. All right, Sylvia. He's
I mean,
okay to
you
move
are-
tonight.
You
All
are
right.
good to go.
Right.
Oh, and you know that our protocol on making sure it stays clean, change out the bandage once a day. Anything looks bad,
Yeah.
smells bad, feels bad, come back and see us.
Yeah, no, absolutely, will do. Will do. Will do. Sylvia, do you need a hand moving this to
Yeah, just I can do all the work for it. Just maybe company out that way.
Yeah, I can help. I think it's the least we can do, isn't it? So,
All right.
I'm just gonna give him. I know you looked for the locket. I'll just look for any, if he has a telegram or
Mhm.
something.
That's the only thing I found was his journal with his own telegram on it. So
I just don't understand why this had to go the way that it did.
I believe this is for you two.
Huh?
Oh, okay. Well,
Yeah.
oh, that explains why he was so upset with us.
Mm-hmm.
What did it say?
nothing good.
Yeah, nothing good.
Oh, all right.
Just as you towards law enforcement in a bit more colourful language.
My goodness, that's uncalled for.
Quite dedicated to the cause, I suppose. All right. No. We all wrapped on my end. I will get that death certificate started, and
No worries. Thank you very much.
of course, I'm very sorry.
It's not your fault, Doctor.
I will take him out the back door so we're not going through the middle of
Yeah.
the thing. Thank you again, you too.
Of course.
You two be safe, and if you keep stitching like this, Mr. Bigsby, I'm sure you'll be certified in no time.
Oh, thank you very much. Take care.
Aye, you too.
Well, that went well.
You did very well with Detective Lindsay there. Anything that you
Are
had?
you okay?
Oh, of course. I just like to take a moment for patience when we lose them.
Right. Of course. I apologize for being abrasive.
I appreciate that. It's good to get to know how different folks take things such as a loss. We go through a lot together as a team, and it's very important that we're there to support others.
Of course.
I
Of course. If you I know I'm just a trainee, but if you ever just need somebody to listen and talk to, you can always, jabber at me.
thank you. And likewise, your way. I'm one of the department's counselors. So if you ever need someone to talk to, the offer extends the same way.
Of course. Thank you very much.
Now, I'm not sure. Was Law present for your operation yesterday?
You mean with one with Mr. Crowley?
Mm-hmm.
Yes, they were present. They were already in the office when we arrived.
Okay, very good. Often, 9.5 out of 10 times, Law will be present when there's been a death, and will take care of transportation. But if they're not here, we are responsible for it.
Right. Right, of course.
Rule of thumb is if it is in Strawberry and West, it goes to Tumbleweed and the Undertaker's office there. Anything east.
You mean Armadillo?
Sorry, Armadillo. You are correct. Yes, would be very inconvenient to go all the way out to Tumbleweed. So Armadillo, if
Just
it's Strawberry and West,
yeah.
keeping me honest, very good. Anything east of that goes to Rhodes.
Right, okay. So the line is Strawberry.
Absolutely.
And if it's anywhere near there, you kind of just take your pick, which journey you would rather make.
No, Strawberry, I would still send to you Armadillo. I think that's still quicker to get there.
Okay, all right, well, that is that up then.
No, you would do the death certificate. You are absolutely, you can write them with all the details you need. In this case, it was very clear how he passed. If you feel like you need to, you can take a little bit of extra time to note some details about injuries, things like that. If they need it, law will request an autopsy. So, you don't have to overdo it, but just note down what is relevant.
Right.
If the next of kin is there, you are welcome to release the body to them rather than moving it to the Undertakers. It sort of skips a step there. They can take them to be buried immediately.
Right, okay.
Now, if, for example, the Undertaker tonight was very busy, what we are not going to do is lock the body back here, where only a medic can get them. So, worst case scenario, we would take it up to the ward. We have a few beds set aside at the saloon, for example, where the body could be stored, but that is truly worst case scenario. The Undertaker is incredibly busy. They have to go right now.
Right, of course.
If the body is somewhere that is not Armadillo or Rhodes, you have to mark it on the file. Otherwise, things get messy very quickly.
Oh, I can imagine. Yeah, of course.
Sometimes an absolute nightmare. To tell a grieving family, imagine that we don't know where the body of a loved one is.
Oh, yeah, that's joyful to have to say to someone.
Okay, here's a question for you. If someone walked into the Valentine office right now and said, I am the father of $1 million banks, where is the body? What would you say to him?
Unfortunately, sir, you weren't listed as a next of kin, so I'm gonna have to direct you to the deputies, and you can speak with them on what they're willing to disclose.
Perfect, very good. Sometimes it can be very difficult to
emotions run high.
Absolutely, to stand your ground. But for example, 2 men approached me and a newer medic at the time asking for information about a body. They were not next of kin, even though he claimed to be a grieving father and was as convincing as I don't know, one of those actors up in the Saint Denis stage. I said no, but they managed to convince Law, and they attempted to steal the body they were from some sort of rival gang.
People have no decency sometimes.
Not at all. And can often be worse than you think they might be. I am not one for cynicism, but the rules that we have in place are in place for a reason.
Right.
any questions about the treatment? It was, I think, quite straightforward, and especially after going through the Cougar drill, I think you, from my perspective, seemed well prepared.
Yes, definitely. I think after that practice application that we had with the shooting cougar, I think I felt more than prepared for this interaction, which was great. Thank you.
I'm very glad. Actually, my husband, Dr. Connor McNamara, he invented the Cougar drill, and that's how I learned. I felt it was honestly one of the most useful things to go through everything from top to bottom. Although, when he did it to me, we were in Rhodes. There was a bank robbery happening, so there was, I want to say, 5 to 8 other members of the department. It was in maybe my first day, second day. And he had assumed that they would jump in and help, but actually all the members of the department watched as I worked through the Cougar drill. Which I think you can imagine might be quite nerve-wracking.
It very much was, even with just Cam there. I was definitely feeling the pressure.
Well, you know, even though we prepare you the best we can, it can still be a bit of pressure when you start out. So, good to simulate a bit of that panic that you have to quell.
Right, of course.
Okay, that paperwork is done. Unfortunately, I think I have to call it here.
No, that's quite all right. I think you've provided a lot of training today.
I don't want to shove too much information into that coconut of yours.
Oh no, I don't think you ever could. You know, half of it's gonna spill out anyway, so might as well just keep filling.
Parfait. I think you have some, you know, of the a little bit more dairy heavy components to go through in your training. The biggest ones that are a lot to talk through. Well, the emergency one is one. Medications is another one. But if you have the chance to suggest what you'd like to learn about, I would do that one earlier rather than later. That way, when you're going through different treatments, you'll start recognizing the names, and you'll have that bit of background to start locking that in.
Right, okay. So I should just, next time I'm training, just whoever I'm with, just mention, yes, I would like to know more about the medications.
Absolutely. They might have an idea for something a little more fun. I am very excited to have snagged the Cougar drill for your training. But yes, I would suggest if they give you an opportunity to suggest what they train you on, I would go for medications.
Right, okay. And I don't know what it says in my files or anything like that, but what are we looking at training wise in preparedness? Are we at, you know, a 50% or 45%?
Medications is quite a big one to go through. The rest of them, I mean, I think honestly I wouldn't worry about it too much, especially because you're showing you know, basic proficiency. What I would focus on are getting the details in. You know, making sure to clean before we inject the medication, to prepare the syringe by tapping out bubbles, things like that. And if you'd like, next time I see you, we can go through a very detailed version of that. The goal is to prepare you to be able to be very detail-oriented if you need it, but then you can back off as you get a feel for how the procedure is going.
Right, of course.
So as you're training, take it as an opportunity to show off all your good knowledge. And then once the wagon wheels hit the road, you'll can be a little more loose with it.
Right, of course.
Parfait. I think, I mean, you're in general very eager to learn. So yes, I would say just keep focusing on getting that practical hands-on experience when you can do it. And I didn't have too much concern in anything egregious in terms of bedside manner. But I would say, focus on getting them talking, especially if you are assisting and not the primary on the case. If it's something a little more complicated where the department member has sort of taken the lead, step in, be talkative, get their mind distracted off of what is happening rather than maybe calling attention to it.
Right. I could definitely, I could tell once you kind of handed over the reins to me, you definitely kept them talking a lot more. So I appreciated that.
No, of course, and it's something that is very difficult to get used to. You're doing a lot. Your hands are busy. But eventually, and honestly, it's why working with another person is great, because then they can take some of that cognitive load. But good to practice when you're a trainee. Pretend you're the only person in the room and be a big old jabbermouth and get curious about things. Throw them off by asking, what their favorite pencil they've ever used is.
What a peculiar question to ask somebody, but I like it.
Yeah, you start running out of, what's your favorite place in the crossing?
I'm sure you get tired of hearing about the different places anyway, and half the people, they just say Big Valley anyway.
Honestly, I don't really get tired of the answers. I get tired of asking the same question, but, partially it's distracting them. The other part is you getting to know them. You'll find that with good bedside manner, you are the physician that they start seeking out. Even if they're in a lot of pain, when you walk in, their face lights up a little bit.
Right, of course.
I love being a senior doctor and training people. Any questions about any of that feedback or other parts of your training?
No, ma'am. I wholeheartedly agree with all the feedback you gave, and I'll work on it.
Okay, beautiful. I would say, there's a big sandwich on your plate. You've taken a large bite out of it.
Oh my! Yeah. I'm quite hungry, actually.
All right. Well, I am gonna jot down some feedback for you, and note that we just what we just talked about. I always say there will be no surprises, and hopefully we can see you again for another shift soon.
Absolutely. I'm probably gonna lay my head down here shortly, but I appreciate you very much.
Absolutely, it's a pleasure working with you.
The same goes to you. But is the door over here? Is it actually unlocked for me?
Excellent question.
Otherwise, it would have been a little awkward. Like, okay, I'll see you later. Bye.
Absolutely, and then just sort of the
can you...
feudal pawing of a trainee at the door.
That's right. Please let me out of here.
Please let me out.
Anyway.
Okay.
Thank you very much, Claire.
Absolutely. You take care.
Yeah, you as well.
Cute. What a cutie. What a cutie patoot. Cam was a cutie patoot today. He was a cutie patoot at the end. And we love that we're streaming because we know how long our shift will be. Okay, perfect. I'm going to do that feedback off stream. And then we'll be good to go. Okay, thanks everyone for dropping by the stream. Is there anyone around to raid? As rude. Okay. Rip. Rip. He dead. Oh, you know who raided us last time? Beth McManus. So we are gonna go give her a little raid. So stick around for 2 seconds. Slash raid. No face. Yeah. Yeah, like I say, thank you so much for sticking around, and we will go say hello. Everyone, go get your snacks, load up in the car, and we will go say hi.